Hey y'all, Shelly here with another tip for hospice nurses. So we're getting a lot of RAC audits that I'm hearing from CMS and the OIG that are centering around the higher levels of care, continuous care, GIP. So today I'm going to talk a little bit about how to document continuous care. So I think we all are pretty comfortable documenting continuous care at the beginning because we're doing all of this stuff. But it's after we got our patients settled down and the symptoms managed and we're in that monitoring period that we struggle with what to document. So I will generally follow this little pattern that I'm going to share with y'all today. And forgive me, I got to go kind of fast to get it all in. But on my first note, so first of all, we want to document at least every 2 hours. That is just kind of the unwritten standard of care that everybody follows. So every 2 hours. So my first note, I am going to document about the interventions that we did and how they are working. So something like hospice intervention of, whatever that is, effectively managing symptoms of, whatever those symptoms were, as evidenced by, and what does the patient look like now. So that'd be my first note. So the second note in 2 hours, I'm going to take that same note and I'm going to flip it. Same thing, but I'm going to start with patient lying in bed, eyes closed, appears calm and peaceful, no restlessness or agitation noted, suggested that hospice interventions of are continuing to effectively manage signs and symptoms of whatever we had. Then the next note, I'm going to take whatever their hospice diagnosis is, and I'm going to say a little bit to support eligibility. So for an Alzheimer's patient, I will say something like, due to the progression of terminal end-stage Alzheimer's dementia, patient is essentially bedbound, unable to effectively express thoughts or feelings, is incontinent of bowel and bladder, requires adult diapers, 100% dependent for all care needs. Just those things that we would document to support Alzheimer's dementia for a hospice patient. And then my next note, I'm going to document education, because we're always doing education while we're there with doing continuous care. So we're educating on the new medicines, we're educating on safety, we're educating on turning the patient, whatever it is, we're always doing a lot of education. So I'll make that note there. And then the next note, I just kind of start this process over again. So when you do it that way, it makes it kind of easy to know what you're going to document next and to have a little time to think about it. So you do your first intervention of your intervention first and it was effective. Then the next note, you're going to flip it to what the patient looks like because of the intervention that you did. Then the third note is going to be your something to support eligibility. And the fourth note is going to be education. And then we just start that cycle all over again. So I hope this tip was helpful. If you have any tips that would be helpful for hospice nurses, please let me know. I'd love to share them here. And remember, together we can change our world.